Summertime, it should be filled with fun, but if you're dealing with achy hips, a walk down the beach, or a trip to the amusement park does not sound like much of a vacation. With us today is Dr. Chris Blackman with the Cone Health Ortho Care Greensboro to talk about help for aching hips. All right, so let's get to it. Besides a fall or like a traumatic injury to the hip, what are some common causes of hip pain that we all might have?
You know, it can be when people are just getting back into exercising and they start increasing their activities too quickly. They can get pain along the side of their hip, which can be more of a tendonitis or bursitis. But other people can have pain just waking up in the morning and they're side sleepers and they can hurt on the side of their hip. And that could be more of a tendonitis or bursitis. If it starts getting into the groin area and other things like that, it could be pointing to more to like something like arthritis. But it's very common to have hip pain. I see that 9 out of every 10 patients that come see me with hip issues don't need surgery. They just have pain on the side of their hip, and it can be radiating from the back or up from the knee.
All right, so I'll say this, when something hurts, right, when anything hurts, including your hip or whatever else, and walking hurts or exercising hurts, the natural reaction is to just then not do that and to be immobile.
Yeah, and a lot of people will just stop what they're doing and then keep from doing activities. And we really want them to still stay mobile, but it is worth listening to their body. And the first things you can do are the common things like intermittent ice or heat, or even over-the-counter anti-inflammatory medications. There are topical medications on the market that people can try. And usually let it go for just a short amount of time. But if it starts really detrimentally affecting your day and becoming the focus of your daily life, my hip is hurting, I need to do something about it, that's when you seek other treatment or seek someone like myself or other orthopedic surgeons to take a look at you to see what else may be going on.
Are there some things that someone should not do if they're experiencing pain in their hip?
Yeah, I wouldn't go on long exercise runs or walks where they're going up and down hills quite a bit, or even getting on their treadmill and putting it on a big incline. Those things could still aggravate your hip. And I think that it's worth avoiding high impact aerobic activities and slowing down and doing less of those impactful things that can irritate a hip.
All right, so that's kind of like a fine line, right? You don't want us just sitting, right? If we have pain, you want us to be moving, but you don't want us to like overexert.
Exactly. The more that you just stay stoic and sit, your hip could get a little bit worse or stiff and things like that. So you want to be, as active as your body is allowing you to be, but not overdoing it.
Okay. Now, how long should someone try home remedies with their hip pain before talking to a doctor?
I usually think about a week or so is what I would do. If you started having pain, for instance, after going to CrossFit or doing some of these other activities, then you rest for a few days, take some oral anti-inflammatories, give it about a week, slowly get back into what you were doing. And then if you're still experiencing pain, then it's worth getting that checked out.
And so we're talking like acute pain, like pain that you're kind of like, this really is bothering me.
Exactly. Or it can still be chronic pain where it's just you get back to your activities and, hey, it's still aching me. I'm still getting bothered by this. What do I need to do? And then that's when it's coming in and being evaluated with just a clinical exam. Sometimes an x-ray is worthwhile. Sometimes it's talking to the patient saying, hey, these are some medications that you can try, and let's be as conservative as possible. And even considering things like injections of a steroid or even physical therapy or a combination of those things.
Okay. All right. So what we're going to do is we're going to take a quick break and we're going to come back. We're going to be talking more about the joint pain and the achy pain here on the hip and what we need to be doing about it. That's coming up after this break.